Hi, I'm Rachel Block, Program Officer with the Millbank Memorial Fund. We've been working for several years now with the Peterson Center on Healthcare to assist states that are advancing healthcare cost growth target programs that help to measure total health spending in those states and the factors that are driving those costs. Joining me today are two leaders and experts in this field. Sean Greminger, who's President and CEO of the National Alliance of Healthcare Purchaser Coalitions, and Gloria Sakdev, who is President and CEO of the Employers Forum of Indiana. Sean, I'm going to start with you. The National Alliance is working to promote a healthcare system that delivers affordable, high-quality, equitable care for employers, other purchasers, and America's working families. Can you explain how the concept of hospital fair price fits into the affordability policy discussion and how it will help to advance better affordability?
As we look at opportunities to try to create a more equitable, fairer priced, more valuable or higher value healthcare system, we found that what we face in many cases is a dysfunctional or sometimes completely broken market, particularly in the hospital pricing space. As you note, hospital prices are probably the leading driver of increased healthcare costs. They're certainly the largest portion of spend. And there's no way for us to fix that problem simply by better purchasing alone. So we focused on significant policies at both the federal and the state level to try to recreate a functional market. The goal here is to create a place where we have better price transparency so that employers and purchasers can actually engage in negotiating power to try to drive their dollars and their covered lives toward lower cost, higher quality hospital systems.
So with that in mind, how do employers and purchasing coalitions actually engage in the policy process at the federal and state level?
We work with the coalitions to engage directly with their delegations, particularly in key areas where they have a key member of Congress who might be a champion or somebody that we need to move along in the process. We bring people to Washington, D.C. and have them actually educate their members of Congress and their staff about those issues and try to move forward with particular policy ideas. In the converse, we work through our coalitions to help them drive policy at the state level. We've got more than 40 coalitions around the country, each one of them having access to state legislators and key policymakers at the state level. And a lot of this is about helping them understand the significant variation we have in hospital prices, what's driving those changes, and using the tools now available to understand where we're seeing the highest prices and why.
Gloria, let's start with how making healthcare affordable became a mission for you and how you decided to develop the price transparency tools, including Sage Transparency, to help to support your vision for making healthcare more affordable.
Healthcare affordability has been a primary concern for employers in Indiana and across the country. Price transparency is really the key foundation point. They can't make decisions on how to, what benefits to offer their employees unless they at least have price and quality transparency. So that's where we started, is how can we bring price and quality transparency to everyone's fingertips? And that tool that we did that by is Sage Transparency. So it's a freely available public tool that has over 4,000 hospitals in it, ambulatory surgery center price data in it, medication data, and even a legislator tab. So we bring 5 different data sets together, all with the goal of helping everyone have more, make evidence-based market and policy decisions.
So Gloria, the Employers Forum has translated the availability of that price transparency information into a number of different legislative proposals. Could you just describe in general the types of strategies that you've been advancing in your legislature?
We spend a lot of our time educating legislators, policymakers on 3 areas of policy. How can we reduce the price of healthcare? how can we look at consolidation more closely and what policies make sense in that space, and accountability. So in the price space, in Indiana, we stood up an all-payer claims database, an APCD, so that there would be more price transparency. And while we passed that law 4 years ago, it just stood up and became publicly available. In the competition space, while we've done quite a bit, maybe perhaps the two biggest things we've done is we prohibited physician non-competes. It was really hard fought. You'd be surprised how many folks want to put a chokehold on physicians and keep them trapped within the hospital systems. We also passed merger and acquisition oversight. It's been surprising to learn that sometimes an insurance company and a hospital system co-own an ambulatory surgery center. So while we're very excited about merger and acquisition oversight by our Attorney General's office, we still think there's room for some ownership transparency in this space. And the last bucket, if you will, of policies that we've been educating folks on is in the accountability space. We were very happy just this past legislative session to establish that employers, they now own their own data and they can audit it. Now, those seem like common sense. It's the employers paying the bill for these claims. Of course they own their own data, but you would be surprised how many people in the middle say, no, we process the claims, we own the data now. That has already gone into effect, and our employers right now are trying to get their arms around obtaining that claims data and finding auditors.
Sean, you had a National Health Policy Forum earlier this year that included your Purchasing Coalition members. We'd like to hear a little bit about what are some of the things you heard at the summit that shaped your policy agenda for this year.
It's remarkable to me how little policymakers, at least in DC and I think at the state level, understand the role of employers and purchasers in the healthcare space. We were able to bring in some of the leading experts around the country to focus on the underlying problems within the commercial market and some of the critical solutions that we're looking for. As I said, the goal was to get this into the conversation, try to advance some health policies, some of which are actually possible, could get done at the end of this year. But a lot of this is about setting up what we're trying to focus on in the 2025 Congress after the new election to make sure that we don't lose momentum in terms of driving toward lower cost, higher quality, better markets.
Thank you, Sean and Gloria, for joining me today. We will look forward to monitoring your progress as you bring a sharper focus to hospital price transparency and related policy actions. And I'd like to thank, on behalf of the Milbank Memorial Fund, the Peterson Center on Healthcare for their support of our activities.